I would challenge you that maybe somewhat inherent in our Western culture, that from the patient perspective, volume is value.
Yeah.
They want more. They want it to be new. You know, there are things that they want that's part of our kind of cultural heritage of wanting it now, wanting more of it, wanting the newest that's available. That almost drives the volume argument from a patient perspective.
Yeah, I think, you know, I don't know that patients at this point have been given enough choice and been given the information to differentiate between more or different options and choosing between them in a way that really captures my value framework. So I think that's the opportunity before us, is to figure out how do we actually, in a shared decision-making, you know, environment where patients have access not to information but actually to knowledge, and that they can express their values in helping to make that treatment selection that really reflects what they want out of care at the individual level. And that, you know, from our perspective, that's how you get at value. And if the end goal of what we're trying to get to is a system that delivers value, the ultimate consumer in this system is the patient. So having that as sort of the central star with which we're trying to align is value to the patient, which again gets you into this world of patient-centeredness, which we can talk about later. At least from the patient perspective, that's, if we're going to redesign and realign incentives as well as not just the payment incentives, but the delivery platforms, how do you do that in such a way that it really allows and empowers patients to express their values and make decisions in the healthcare environment that reflect what they're trying to get out of their care? And I would suggest to you that, you know, because that answer varies so consistently from patient to patient, if given that choice and given a system that allows them to do that, I would guess that oftentimes patients would make different decisions than what you might think that they would make.
And, you know, Bruce, I want to add to it. We've been sort of focused on the numerator here, if you will, not to get mathematical, but in terms of the quality or outcomes component to this. But the cost component is equally as challenging, because you're talking about, a lot of times we gravitate right to literally the value associated with the drug.
Yeah.
And, you know, the fact of the matter is there's a value associated with their overall care, which includes their hospital care, if that's involved, their radiation, their radiology as well too. So this is very complex, and the one thing I would challenge, and I think it's going to come up in our discussion today, talking about all these calculators and all of this other stuff, is that it can't just be about the drug. Because Milliman, we commissioned a study that was released recently by Milliman that shows the drug piece, which is very important and something that has to be controlled. But it's only, if you look at the Medicare side, it's 18%. If you look at the commercial side, on average, it's 21%. It's only a piece, about 1/5 of all the costs that include when you talk about treating cancer.